Welcome to the 2012 National Kidney Foundation meetings. On behalf of eAJKD, the official blog of the American Journal of Kidney Diseases, I'm Tejas Desai, and I'm proud to be joined by Dr. Stephen McMurray from DaVita. Welcome.
Thank you.
So tell us a little bit about the research you're presenting here. It focuses a lot on cost savings, which is a hot topic in nephrology. Tell us something about that.
DaVita participated in the CMS end-stage renal disease demonstration project, and so one of the things that we were interested to see was whether a more integrated care management program could save money during the cost of this. And so we were able to demonstrate a significant reduction in cost in 2009, and I think this bodes well for the healthcare delivery system.
Now you compared your savings with the Medicare 5% fee for service, correct?
We did.
Can you tell us a little bit about that comparison?
We felt that this was appropriate because in the demonstration project, the nephrologist and all the services that we provided were paid for in a fee-for-service manner. So there were no negotiated contracts, no capitated contracts. So we felt the comparison between the two groups was very similar, and in fact, we were able to show that in the paper.
Now, when did you first start seeing the savings?
We started seeing the savings in 2008, and then even further savings in 2009. Program started in 2006, but as with any program like this that was new, there was a slow ramp up. So the savings happened after a couple of years of participating in the program.
Well, were you able to stratify as to where the savings were most?
We weren't able to exactly demonstrate where that was, but we think it was due to reduced hospitalizations. Okay. And there was a large focus of the program on preventive care. Okay. So making sure that all the ESRD patients were immunized against flu and pneumovax, that they received appropriate diabetes care, a lot of focus on vascular access and eliminating catheters. And then focusing on fluid management, making sure that blood pressure was controlled and that dry weight was obtained as much as possible. And we did see a reduction in hospitalizations as compared to the USRDS data. But with all the interventions taking place, it's hard to say which one was the most effective. But we think the continuum of care of doing this and then having the care coordinator coordinate the care between the nephrologist, the health plan, and all the various subspecialists who were there really made a difference.
So were there any other results that surprised you while you were doing this analysis?
I don't think anything surprised us. I think that we were pleased that we were able to achieve the preventable goals that we wanted. We were able to increase flu and pneumovax immunizations to greater than 90%. We were able to substantially reduce catheter rates below 10% during this time frame and subsequently reduce them into the 6 or 7% range. So we think that's been really helpful and beneficial to the patients participating in the program.
So where do you go from here now with your analysis and these cost-saving measures?
What we did after the demonstration project was completed was we began an ESRD special needs plan. And so, which is like a Medicare Advantage program that just addresses the ESRD patients. So with our nephrologist and health plan partners, we've been able to continue the program and been able to add new and additional services to help coordinate the care of the patients. And we think we'll see continued improved outcomes and continued savings as this goes forward. I think the important part for all of us in this is that this can be a model and a roadmap for how care might be delivered to ESRD patients in the future. Certainly fits in with the government's programs of an accountable care organization, and I think can give us a framework of how that might look to coordinate Part A and Part B services to better serve the patients.
Well, thank you very much, Dr. McMurray.
Appreciate it. Thank you.
Thank you very much for joining us at the 2012 National Kidney Foundation meetings.